just let me know by voice. Hold on one second. That you can hear me. Okay. So good afternoon. My name is Bryles Johnson. My colleague Garrett Pierce and I are with the North Carolina Commission on Volunteerism and Community Service. Thank you for joining the Lunch and Learn series hosted by the North Carolina Center for Nonprofits, NC Strategic Partnerships, and Volunteer NC. Today's program will be recorded and posted on the Volunteer NC YouTube site. The link, along with any materials by today's speakers, will be emailed to you by tomorrow afternoon along with the survey. Please complete the survey so that we can continue to provide programming that will be most useful to your organization. Today's presentation will have American Sign Language interpreters, and CART or closed captioning will also be provided. Captioning today will be provided by Carolina Captioning. Please make sure that you select side-by-side gallery view so you are able to see the interpreters. Just a few things to note. We will have time for question and answers after the presentation. So please enter your question in the chat box or raise your hand to be unmuted to ask your questions. One other thing, please make sure that you are muted during the presentation and your video is off. Okay, so with all of those details out of the way, let's go ahead and get started. Today's topic is disability preparedness resources for disasters, best practices for your nonprofit from our state's experts. Our experts joining us today are Cheri Dean, Disability Integration Specialist with North Carolina Emergency Management, Donna Platt, Emergency Preparedness Coordinator, Division of Services for the Deaf and Hard of Hearing with North Carolina Department of Health and Human Services, and Meredith DeNaples, Deaf Services Specialist, also with the Division of Services for the Deaf and Hard of Hearing. We are very excited to have you all join us today. And with that, Cheri, take it away.
Good afternoon, everyone, and thank you for coming today. As Bryles mentioned, I'm the Disability Integration Specialist with North Carolina Emergency Management. And as part of my responsibilities, I perform and engage with a variety of people that are both people with disabilities and working with agencies and organizations in the community to help people that may engage or work with people with some type of disability. What I would like to do today is talk about some basic preparedness things that you can do. Next slide, please. And what I want to do is talk about a basic three-step process that can be used in any type of environment, whether you find yourself at work, at home, even in your vehicle somewhere. In any type of emergency, we need to have a plan. And I'm going to talk about each of these in just a little bit more detail here momentarily. So each of these steps to give you an idea, and I'm going to be providing resources to be able to help you expand because some of these steps can get a little more involved. Next slide, please. So the first one I want to talk about or touch on is planning. So regardless of where we're planning, if we think about organizations that we work with or agencies or groups, you want to have an emergency plan that addresses how you're going to approach and deal with an emergency or a disaster if something happens. There are several sites that can be very helpful with this process. Ready.gov/plan that I have listed there on the slide actually provides a template to help you go step by step, if you like checklists, to help you go through and guides on planning each step. But what you want to do is think about if something happened, for example, you're at work and an emergency or disaster happened and you're going to be stuck there. How are you going to deal with that situation? So you need to spend time thinking about and planning, writing down what you're going to do. So whether you sit down as an organization, you sit down as a family, or even yourself, people that you work with in the community that are disabled, sit down and write down a plan on how you want to deal with an emergency when it happens. There are a couple different resources that are available that our hosts are going to be distributing tomorrow, as Briles mentioned. One of them is a planning checklist for organizations that serve people with disabilities. Although this particular document focuses on people with disabilities, it's an overall good resource for any type of agency or organization to help you think about the basic steps that you need to take in creating a plan, and then documenting and even practicing how you're going to respond in an emergency situation. Another document that's very valuable is an emergency preparedness toolkit for persons with disabilities. This particular document actually has several key checklists in it to help you through creating a plan and the preparedness process that I'm going to touch on here in a minute. And if we're really thinking about organizations, one of the things that's really good is the federal government has created a planning suite with step-by-step guides to help you as an organization or a group create a business continuity plan or a continuity of operations plan. You see these terms used interchangeably. They're relatively the same type of document. This particular software will help you go through as an organization and the basic steps you need to think about. And the overall goal is, if you are an organization or you work with people in the community with disabilities, or even if you don't have somebody who is disabled, either as an employee or work with them in the community, is as an organization, you want to look out, how can you stay functioning when a disaster happens to continue to serve your clients, your customers, and to continue your operations. One of the other types of plans you need to consider is a communication plan. You have basic steps that you do this. They're known as collect, share, and practice. In this particular process, what you're focusing on is, in an emergency, you may actually lose power. You're going to lose the inability to charge your computer, to charge your electronic devices. So what are you going to do when something happens? As an example, say that your office is in a multiple-story building and the power's gone out. How are you going to communicate with your employees that they need to evacuate because you found out that the power is not going to be back on until late at night? That's something you think about and write in a plan on how you would potentially deal with different types of situations. You want to collect contact numbers. We're so convenient and used to using our phones, but you need to have a written form as well that you can put in a little kit that you carry with you if it's work related, to be able to reach out to people, your calling tree, for example. If it's for family members, you need to have everybody's contact information, the medical providers, written down so that you have a way to reach out if necessary. And you want to share information as an organization with employees to be able to do stuff. And finally, you want to practice the plan. So as any part of a plan, it's important to practice a couple times a year at minimum. Normally, if you're looking at really focusing on continuity planning as an organization, or even personally, it's good to do it at least quarterly, where you actually sit down and you respond as if a certain type of emergency has happened. Plan how you're going to do stuff and respond as if you're in that situation, because we all will know that saying, practice makes perfect. The more we practice, the more it's going to help us identify if maybe there's any holes in our particular plans to be able to supplement or to add information to our plan. Next slide, please. A key step for any type of disaster is to prepare. It doesn't matter where we are. We could be at the office, at home. We could be out in the car in a major snowstorm, and suddenly you can't get off the freeway. You know, what are you going to do if you're stuck in your car on the freeway in heavy snow and can't move? Or what are you going to do if a disaster has created a situation where you're stuck in your office for 3 or more days? Do you have disaster supplies in your organization, in your meeting areas that can help your employees and your clients survive if you were stuck in your building for 72 hours and unable to leave? We have to think about general and individual items. On a general level, the picture below provides a really good example of the common things that are general items that belong in a disaster preparedness kit. As an organization, you want to think about, are you going to actually create organization response kits and have them in key staging areas in your office? Or are you going to only set certain things aside and rely more on your employees? That's part of a decision you make when you're planning things out and thinking about how you're going to respond. Again, if you're, for example, stuck in that building for 3 or more days and you just can't get out. You also have to think about personal or individual items. Good examples of those that you want to think about having in a personal kit, no matter where you are things such as medications for several days. That's recommended for a period of 3 to 7 days that you have that extra supply. And that's normally something that you can work out with your physician. Other things to think about, items to keep your children occupied, or pet supplies if you have just family pets or even service animals. I can tell you if you do, or you have clients that have service animals, if they find themselves in any type of shelter or service center environment being assisted and they need help feeding the service animal, they can actually request assistance, and the providers can get food and necessary supplies for that service animal. Both of the Ready NC website and the Ready.gov federal website are excellent resources with checklists and items to help you prepare. There are also specific checklists that are going to be distributed by our host in tomorrow's email to you to help with each of these general focus items and recommendations on what you should have in kits. And don't forget to personalize them. Also think about things like food. Do you really want those dehydrated food bars that last forever? Are you going to eat those if push comes to shove? Or do you want something that is a little more palatable, that you just have to be conscious of rotating a little more frequently? Next slide, please. When you're in this preparedness process, you're not alone. You certainly can look at checklists and do things. And whether you're creating and preparing for your family, for your business, you're always capable of reaching out to local and county emergency managers. Not all local jurisdictions and municipalities have emergency managers, but quite a few do throughout the state. All counties have emergency managers. If you reach out to a local jurisdiction and they don't have an emergency manager in municipal level, they will let you know to connect with the county emergency manager. If you're really looking at planning for helping people with disabilities, you can actually reach out to your local Center for Independent Living for assistance, and they will help you with planning and ideas of how to be prepared and to be able to help if you work with clients with disabilities. And if you find you've kind of hit a roadblock, please feel free to reach out to me. My email and phone number are here, but they are provided again at the end of my presentation. And the slideshow is going to go out to you tomorrow, so you will have that if you would like to reach out for assistance. Next slide, please. The final step of this three-step process is staying informed. No matter where you are, whether you're at home, where you work, you need to know the hazards that occur. Some of them you may be more cognizant of, like pure example, say that you live over in Wilmington and you know when a hurricane comes in that area that storm surge might be a problem. Other hazards may not be as obvious. If you're not as aware of the type of hazards or emergencies that occur more frequently in your area, that's definitely something that your local or county emergency manager can identify for you. As part of their planning process for the county, they actually are required to identify anything that can potentially happen in that area and plan for how a response would occur to it. You need to have a method for monitoring weather and receiving emergency alerts. A common way to do that is with a weather radio. There are a couple of different varieties available that you can buy in large grocery chains, electronic stores. You have constant access to weather reporting and alerts. And many radios actually allow you the capability to edit down specific notifications you want for a certain area. For example, you could set it to let you know when a tornado is on the ground, and that would alert you if one was within 15 miles of you. You could turn off the alert for snow avalanches, since that's really not a problem in central North Carolina, for example. So you kind of have some options. A couple other ways to get alerts: wireless emergency alert system. You have probably gotten some of these off and on. This comes across on your cell phone. You do not have to register for these. This is anything from an Amber Alert to, if you have the function in your phone turned on to accept emergency alerts, you can also get blasts of emergencies out. And that emergency will focus on the particular area that you're in. It surrounds a certain radius of an area. So say that there's a severe thunderstorm and lightning warning that's been pushed out by the Weather Service. If you're in that immediate area that affects, it would come across your phone as an alert. If you drive out of that area, it's not going to happen. But maybe you've driven into an area where a different alert is going on. Maybe there's a tornado watch because of spinning in the clouds. Nothing's set down, but there's a watch. So the minute you drive into that potential affected area, it's going to send an alert to your phone. So wherever you move, it actually picks up to be able to send you alerts if you have that function on your phone. And finally, you actually can subscribe in many jurisdictions to receive alerts from your local government, and they'll push out things such as emergency broadcasts for your area. That is something you could go to and look up your emergency management county offices, or where they most likely exist, and see if they're available. And if it's not obvious, feel free to call your local emergency management office. They are more than willing to speak with you and to discuss that, or refer you to perhaps one that covers the area sufficiently. Next slide, please. And I just wanted to touch for a minute or two on disability integration and explain how it kind of connects with organizations and what's going on in North Carolina. Next slide, please. So within North Carolina, the focus is including people with access and functional needs in all aspects of emergency management. So we have 5 basic steps or cycles. This is a circle that's constantly moving. And people with access and functional needs are involved at every single one of these levels. We have works groups that exist, both with people with disabilities and agencies that work with people with disabilities that are involved with our planning and prevention and response groups, and involved in the committees at each of these different stages to advise us if maybe we're missing something or stuff we need to be conscious of. If you actually have any potential interest in participating in any of these, please feel free to reach out to me. I actually lead quite a few work groups on different topics related to access and functional needs. Next slide, please. And I just wanted to mention one particular interest or work group, and that is the agency or organization disaster readiness work group. And why I'm mentioning it is, although my focus is heavily on disability integration, what this particular work group has done is actually focusing on increasing community-based continuity planning and making sure that agencies and organizations can serve people during a disaster. So what we want is to make sure that agencies that work with people with disabilities, that they can remain functioning to not only be able to help to serve their clients in the time of a disaster, but to be able to continue to provide services and stay operational when something does happen. And this is what moves us back to continuity planning and planning out how you're going to respond and deal with things. The group has actually created 3 reference documents, one with references and 2 special checklists for planning that our hosts are going to be distributing to you tomorrow. Next slide, please. Okay. The 3 documents that I just mentioned, I just jumped ahead of myself there, are the documents that will be distributed tomorrow that were generated by the work group. And that group is actually also working on a continuity planning 101 presentation right now, similar to the vaccine 101 thing that can be shared when we do get it completed to try to make it simpler for agencies. And finally, I just wanted to mention one particular thing, and that's the functional assessment support team. This falls under some things. If you work with clients that have disabilities, you have family members that have disabilities. If they find themselves in shelters, if you find yourself in shelters and that you don't have equipment, or your clients don't have equipment that they normally require to be able to function on a daily basis, the functional assessment support teams can deploy into the shelter environment to be able to assess people and to be able to help get the equipment that's needed to help them maintain their own independence and stay within the shelter environment, or in a hotel, for example, if we're using non-congregate sheltering. And my last slide, please. Okay. And just again, that's my contact information. It will come out in the slides tomorrow, and I will be available for questions here at the end of our presentation as we hear from Donna Platt and Meredith DeNaples. Thank you.
And I'm just waiting for my interpreter to turn on their video. My name is Meredith. And sorry about that. Let me start again with my other interpreter. And we seem to be having some technical issues. Go ahead with the next slide. My name is Meredith DeNaples, and I'm the Deaf Service Specialist. Cheri presented on preparing for disasters. And when you're thinking about people with disabilities, Donna and I directly work with people that have hearing loss. Communication access during disasters is very important. And if you could go back one slide. Right there, perfect. We do have a lot of information, but with our limited time during the Lunch and Learn today, we try to give you just what you needed today, but you can contact us for more information. And hearing loss is not something that you can visibly recognize. I wanted to ask the audience, and you can feel free to type this answer in the chat box. My question is, how would you recognize someone who has hearing loss? Any answers? Go ahead and type in the chat. Okay, and if you could go to the next slide, the drop down. There you go. Thank you. Leaning in was something that Briles mentioned. You may notice that they're wearing a hearing aid or have a cochlear implant, or you notice that they're not responding like you would expect. Maybe they have a puzzled look upon their face, or they seem really frustrated with communication. Maybe they're focusing on your lips, trying to read your lips. Those are some signs. Maybe they'll start texting you and showing you their screen, whether it be a laptop or their mobile phone. Next slide. So when you think of communication and in providing that communication with people to hearing loss, you may think that everyone can read lips. That's a good solution. But there's different types of communication for each person. There's different types of hearing loss as well. Their method of communication is very individual. Some people were born with a hearing loss. Some have acquired the hearing loss later in life. Like today, you notice that I'm using American Sign Language. Not all deaf or hard of hearing people use sign language. Some are able to use their voice and able to speak very clearly, but doesn't mean they can hear clearly. There's also a category of deaf blind, and they use what's called tactile or hand on their hand interpreting. Captions like we're using today is really a good resource, but not everyone prefers that. So there's no one size fits all, unfortunately. Now I'm going to pass it off to Donna. Hi, everyone. Next slide, please. So some communication challenges. Cheri had mentioned access and functional needs. One accommodation for that group of people is communication. And again, people with hearing loss, they could be deaf, they could be hard of hearing, they could be deaf blind. And each has a different communication need, and that presents some barriers, especially in emergency services. The access to alerts, evacuation instructions and information, when they're doing intake at shelters, applying for food stamps or recovery services, those all present different difficulties for people with hearing loss. And especially at shelters, for example, all that information is audibly given, and they would miss that information. Next slide. Now you see the word ASL on my screen here. ASL is American Sign Language. We do have some videos that can be resources for you. And the reason why we provide these informational videos in American Sign Language is because English and American Sign Language are very different languages. Each have their own syntax and grammar. So there's not one way of communicating. People that use American Sign Language often have difficulty reading English. So if they watch this informational video in ASL, it's much more clear and they have access to all the information. I have some links posted there with information on emergency preparedness. You see on the right-hand side, We have Get Ready NC has some different videos and examples of where to go for shelters, which depending on which county you're in. If you need to evacuate, that's good information for your shelters and your volunteer workers to have. Know Your Zone is another website and videos that are provided in sign language. In my division, the Division of Services for the Deaf and Hard of Hearing, on our website, we have access to a myriad of videos. You may notice the governor's proclamations or informational press conferences always have sign language interpreters. Now, if there's a specific topic they're talking about, testing or contact tracing, the vaccines, all that information is provided in ASL on our website. We also have communication tips. Next slide. And if you could go back one slide, please. There you go. Perfect. We also have training videos for providers, people that work at shelters, recovery centers, long-term care centers. We have tips on all of those. We have training information. During a disaster, there's so much happening at the same time, and you're trying to get the resources set up, and everything is moving very quickly. So many of them haven't received training in terms of communicating with people who are deaf, blind, or hard of hearing. So these resources are great to have at hand. We have these videos that are ready, they're called just in time videos. So if you encounter someone with hearing loss that's deaf, hard of hearing, deaf, blind, like Meredith explained, one size does not fit all in terms of the communication access that they may need. Each of these vignettes is a minute long, so your staff can access those. So please share them with your staff and volunteers, and they can watch them and have that information at the ready. The two other materials I have listed are apps. If you're dealing with someone who is hard of hearing, those are helpful ways to communicate. The third one is using the relay service. It's a relay service is with a spoken language interpreter. They have that. We also have a relay service for people who use sign language as well. Cheri and Meredith mentioned that we would be sharing these PowerPoints with you so you can refer to them later. Next slide. We also have a list of mobile communication apps that I had mentioned that you're able to download on any smartphone, tablet, or laptop that you may be using. And these apps, there's three in particular. There's one called amplification. That means increasing the sound for your hard of hearing community. There's a speech to text where you can speak into the app and it will convert it to text. So you can type back and forth with that person. So those are listed in that document. We also have what's called a Clear Mask project. The Division of Services for the Deaf and Hard of Hearing, DSDHH, is providing clear masks at no charge to providers and consumers. The clear mask you may have seen is a clear see-through mask that still provides that protection, but the consumer is able to read your lips and able to communicate better. Now, on August 1st, this distribution plan will become a box plan where we'll send you an entire box of 24 masks. So you can register for that. And again, that's free, a whole box free to have that ready during an emergency. We have communication tips, places where you can also purchase these clear masks as well. And that information will come with the box if you register. We do have videotapes, videos of people that show how to communicate with the clear mask. So I suggest you look at that website, and that way you'll be ready for any emergency that may come about. Next slide. And I'll turn it back over to Meredith.
Okay, I'd like to talk about North Carolina Division of Services for the Deaf and Hard of Hearing. We often call it DSDHH. We have an administrative office, and that is set up in Raleigh. And then we have 100 counties that we cover with 7 regional centers. So we do travel to you. And we also provide our services in those locations. Next slide, please. Now, if you notice on the map, we cover 100 counties and we have 7 regional centers. For example, I work here in the Wilson Regional Center, and we cover 24 counties, more northeastern areas in those counties. And I'll mention a little bit about that in a later slide. And if I can have the next slide, please. Each center, they all have the same amount of individuals who work there. They have 7 workers. And then also we have 2 individuals that work in 2 centers, and they work with deafblind individuals. But if you notice in the bold print, the community accessibility specialist, they are your primary contact for your local areas, for emergency, first responders, non-first responders, nonprofit organizations, to be able to contact that person. So if, for example, if you have a deaf individual that needs help, the community accessibility specialist will give you information to contact me, and then I will actually do the direct services and make sure that I'm focused on that. And next slide, please. The community accessibility specialist does systematic advocacy, support, consultations. They provide resources and tools for effective communication and to how to prepare for disasters. They also, when you're working with deaf, hard of hearing, and deafblind individuals. And if I could have the next slide, please. And I'm going to let Donna turn it to you, over to you.
I'm the Emergency Preparedness Coordinator, and I provide support, consultation, resources, and trainings statewide. We work with federal agencies to make sure communication plans and communication access are in place before, during, and after disasters. We also work with 911. We help with developing policies, procedures, guidelines. We'd be happy to provide feedback for any documents that you may develop. I do provide support to our community accessibility specialists, and they work with the cities and counties primarily, and I'm at the state level and work with federal agencies. So that is a delineation of our roles. Next slide, please. During a disaster, the Division of Services for the Deaf and Hard of Hearing, again, I'm referring to at the state level. One example of that is the governor's press conferences. You notice that an interpreter has been providing communication access during the entire pandemic. The Division of Services for the Deaf and Hard of Hearing, DSDHH, provides those sign language interpreters to the governor and will continue to do so. I'm also a member of the State Emergency Response Team. We call that the CERT team, and it's for human services. We're on standby to provide any resources and support that you may need. And it's not only sign language interpreters that we provide. We also provide advocacy, We have an equipment loaner program and different types of resources depending on the exact need. Again, we provide support to the state and federal level. And from the time of the disaster, planning prior to and during recovery, we provide access to emergency providers as well. We're here to support you at whatever level you may be. One example of this, if we get notification from a federal agencies, I will feed that down to our community access specialists, and they will share those resources with the community in that catchment area. So that information is disseminated from the top down. We do attend different meetings for emergency preparedness. We post things on Facebook, so you can keep an eye out for those. Next slide. Related to disasters, our regional centers do also provide support. We do try to reach out to at-risk consumers before, during, and after disasters to make sure that they have the information and the resources that they need. And those resources could be from federal, state, or county. We do share all resources with them. And we do make sure that all the customers in our different catchment areas do receive all the information necessary during their time of need. We work with the customers one-on-one if they need any advocacy during that time of disaster. Sometimes we do refer them out. If they need some type of assistance, we may refer them to our depth service specialist. If they need equipment that may have been destroyed during a storm, for example, we have all different services that we can provide to them, and we have a loaner services that we can get equipment back out to them. Next slide. And I'll hand it back over to Meredith.
So our services are open to individuals who are deaf, hard of hearing, and deafblind, also family members, professionals, agencies, organizations, preparedness individuals, and we assist also with making sure that they get communication access. The Division of Services for the Deaf and Hard of Hearing ensure that all people have access to communications to meet their needs and make sure that it's effective communication. We do equipment loaning, assistive listening devices, phone equipment, hearing aids. We could also provide some of these to shelters and long-term recovery groups. Also to volunteer organizations and customers as well. And next slide, please. The primary contact, again, would be your community accessibility specialist. And so you would need to know which county that you're under. So you can press this link and you can find that information there. And we are so willing to work with you and to try to help to meet your needs out in the community. We do have resources. We can do some practices with you. We can also help you to contact the appropriate people. And again, make sure you contact your local counties. Now, if it's a state or national wide level, we make sure that that's where Donna comes in, Donna Platt comes in. And next slide, please. Now it's your turn, Donna.
This is Donna. And here on this slide, I'm showing you how your organization can start the conversation about planning for disasters and how to provide communication access to the deaf deaf, blind, and hard of hearing communities. This can be worked on with your staff or your volunteers. I've provided a list of questions that can start the brainstorming process to again help you start the planning stage. You can absolutely reach out to one of our regional centers. We'd be happy to help you with this process. If it's at the state level, federal, or national, you can contact me, Donna Platt. And again, we're happy to work with you and provide you the support that you may need. Next slide. Some key takeaways. Again, every individual with hearing loss has his or her own communication needs and what fits them best. Always remember, not one size fits all. The best thing to do would ask the consumer, how can I help you communicate effectively? And try to meet that request. Now, some people that you encounter may not be very savvy when it comes to advocating for themselves. They may not even want to disclose that they have a hearing loss. Some people are in denial that they have a hearing loss. But providing communication access is important, so try to do that the best way you can. And please don't leave them out in communication. Their health, safety, and well-being are at stake. Next slide. And please feel free to reach out to myself or Meredith anytime if you have any questions or you need assistance. We're here to provide the support you need. Thank you so much, Bryles and Garrett, for welcoming us today and having us present. And thank you for your participation in this lunch and learn today.
What great presentations. Thank you so much. This was wonderful. We appreciate everybody coming together. Now it is time for question and answer. If anybody has a question, either raise your hand and we can unmute you, or feel free to put a question in the chat box. Okay, Garrett, if you don't mind closing the PowerPoint really quickly. Thank you. Okay. Anybody have a question? Okay, let's see. Well, if there are no questions and if it is okay, we have a few minutes to hear some partner updates. I'd like to call on Dale Deese and Curtis Hill if one of you want to start. I know you have some information and resources to share. So who wants to go first? Curtis?
Yes, I'm with Disability Rights North Carolina, and we have a wonderful project. We're trying to get vaccines to people, and it's called Project Access, and it's a statewide project that we're working with ACL, USAID, and Tally's group. It's called I forgot the name, but yeah. So it's a statewide project, and we were in Gates County for our second dose last week, and the governor was there, so we're really excited trying to roll it out to a statewide bandwidth to try to make sure that people with disabilities are getting access to vaccines. We also have another project in our office where we're trying to make sure that formerly incarcerated individuals are getting access to IDs. So those are two of our major projects that we have running right now. We just want you to spread the word, and the information is on our website, and we're looking for other sites for our Project Access for us to be assisting with. So if you've got an area that you want us to go to, we'd be greatly to put it on our list. Thank you so much. Dale?
Okay. I'm Dale Dees, co-managing attorney with the Legal Aid of North Carolina Disaster Recovery Team. I just wanted to mention very briefly that we will be conducting 2 Wills clinics in the month of August. First one will be in Columbus County, actually, at Southeastern Community College on Tuesday, August the 2nd, beginning at 10 a.m. And the second clinic will be in Brunswick County in Charlotte on Saturday, August the 28th at St. Brendan's Catholic Church, located on Highway 17. If anyone is interested in either of these events, I'm going to put my phone number in the chat, and we will send you the relevant information if you wish to participate in either of those events. Thank you so much.
Okay, thank you both very much. And I guess we're going to wrap up this presentation. If anyone would like to ask a question, now is your time. It would be great. Okay, I don't see any hands up or any questions. Okay, actually, I do have a question here. During an active disaster, when we are assisting survivors with physical challenges, what is the best point of contact for trying to get glasses, hearing, etc.?
Hi, Bryles. This is Paul Dunn with North Carolina, South Carolina Disaster Services, Lutheran Services. I typed that. I was trying to get it before we exited, so I hope it made sense. When we're at a DRC, Disaster Recovery Center, or we're out in the field, especially during the response phase when the disaster is really active. In the past, we've had challenges trying to find walkers. People have lost their hearing aids, that type of thing. And valuable information today. We're extremely grateful. But if anybody has a point of contact, I know we utilize our partners and friendships at 211. But if there's any DIA contacts, that would be very useful for the folks, boots on the ground, active during a disaster. We appreciate you all. Thank you.
This is Cheri. If I may comment for a minute. Again, I'm the Disability Integration Specialist with State Emergency Management. If somebody is missing things like equipment, walkers, and things like that, if you are anywhere or a client is anywhere near any type of disaster service center, a shelter, they don't have to be a resident. They can go over there and make connection with any member of the shelter team or the staff at the facility. And if a FAST team is not already on site, they can be sent out there. We actually have 17 trailers located throughout the state. They are controlled by jurisdictions, but they are stocked with an array of equipment, everything from walkers and wheelchairs to a variety of other accessibility things. What happens is the shelter manager will relay any needs to the local emergency manager if they don't have access to a trailer already and they actually need something. So if something's not immediately there, the FAST members can actually help negotiate getting equipment out faster and reach out if necessary. If it's not available locally, the local emergency manager will bump it up to the regional or the branch offices. There may be equipment immediately available in the branch area that can be delivered in a very timely manner to help people meet their needs. And then if necessary, it can be bumped higher to be able to expedite getting that type of equipment out. Hearing equipment, I certainly will hand that off to Donna and other people. I do know specific medical needs, excuse me. Temporary stuff you could probably get to Donna, and she'll probably say something in just a minute, but medical staff can also help connect in getting prescriptions again if necessary and do stuff. I'll let Donna kind of complete my thought about hearing.
This is Donna. Thank you, Paul, for sharing those resources. Speaking specifically to hearing aids, you can contact our division, the Division of Services for the Deaf and Hard of Hearing, for those resources. And we can meet with that person individually about their hearing need. Some of them may have even received their equipment from us. We have a distribution program for hearing aids, so they can get their hearing aids through us or other agencies. And if they need another one, they can absolutely apply, or we can replace their current equipment. We can help. If they did not get their equipment from our distribution program, they can apply for a hearing loaner program. That's a new program we just started. It's been up and running for less than a year, but they can apply to be loaned out a hearing aid while they wait for a replacement. We have other assistive listening devices as well, and we can certainly lend those out. So I hope that helps. And again, you'll receive the PowerPoint tomorrow, and our contact information is there. Please reach out to me and we'll get those resources out to you, and we'd love to work with you all.
Great, thank you so much. Any other questions? Okay, well, we've come to the end of our hour, and I just want to thank everybody so much for being here, and a special thank you to our wonderful presenters, to Cheri and to Meredith and to Donna, and to thank you all so very much for this wonderful information. As Donna just mentioned, we will follow up with an email tomorrow, which will include the copy of the PowerPoint, a link to this recording on our YouTube channel, and also a link to our survey. I'm actually Hello. Hi. Sorry about that. I just wanted to thank everybody for being here. I just plugged in the survey on chat. I want to make sure that we get your information to you. We will send out, as Donna said, we will be sending out the presentation, the PowerPoint presentation, as well as the link for the YouTube and the survey. So thank you all so much for being here. Donna, Cheri, Meredith, you all were wonderful. Such great information, and I appreciate our partners Dale and Curtis also for giving us some updates. So thanks everybody. We will be sending out information and more information on future webinars coming up soon. So thank you so much. All right, take care, everybody. Bye-bye.